All right, I have a question for you. Do you wake up in the morning and you struggle to see the clock? Do your glasses get in the way of you doing your favorite activities? Well, if you answered yes, then maybe you need to do something about it. I want you to meet Dr. Seth Salima. He is with Nationwide Vision, and he's here to dispel some of those myths surrounding LASIK and how it might be right for you. First of all, welcome to Sonoran Living.
Well, thank you, and thank you for having me. You look lovely today. It's a pleasure to be here.
Well, thank you. You look handsome yourself.
Thank you.
And I can see that. That's a joke, right? Because a lot of people can't. Dr. Salima, they struggle. They're wearing glasses. They're trying to, maneuver through the day. They get in the way. How do you find out if you're truly a good candidate for LASIK?
So the first step is really to start with that consultation, and that consultation can happen in maybe one of two ways. The first is to visit your local optometrist, obviously is what I do every day, and we can determine based on your prescription whether or not you would in fact be a good candidate. The next is to maybe visit a local or our surgical center for a free consultation that will help to determine all of the factors that will determine if you are a candidate for the LASIK procedure.
Okay, excellent. Now, a lot of people think that, okay, so, I'm doing this now and I can't see,
The old accordion.
Right, yeah, my arm's not long enough anymore. That doesn't necessarily mean that you're a good candidate for LASIK, though, does it?
Right, so when we consider LASIK, what we want to determine is really what the most or biggest issue is.
Okay.
And a lot of times our LASIK procedure is designed for patients who are having more trouble at distance. So we can help patients who are having trouble with the up close, but it really depends on the reason. If you're having trouble with this right here because of the number of birthdays, that makes it more difficult for a laser procedure to be as effective or successful. So it's really about the patient who's having trouble seeing far away, wearing glasses and contacts constantly. Those are the kinds of patients that are probably going to be more successful in the treatment. Okay,
excellent. But here's a question a lot of people have. So I get LASIK surgery. Now I can see far away, but I can't see close up still. You have to still wear reading glasses. Is that true or false?
So to some degree it is a true statement. Between about 43 to 45 we have what's called presbyopia. It's that, again, that accordion effect where the focusing system just kind of goes kaput and we need help for the up close. So you may in fact need reading glasses. However, that may not always be the case between that particular time, but we know that eventually, we're all going to get there. We're all going to need some help for the up close.
Yeah, unfortunately. All right, let's talk about the procedure itself. You find out you're a good candidate for it. First of all, does it hurt?
That's a great question. The procedure itself is about 15 minutes or so per eye. It doesn't take long.
That's it?
That's it. It's a very quick procedure. Filling out the paperwork is probably the longest portion.
If you can see it, right?
So as far as the pain or the uncomfortability, the actual procedure itself is relatively fine. Their patients have really no irritability or any fatigue or anything associated with the actual procedure. Now, that doesn't include when they actually lift the front of the eye to make the incision. When they lift the front of the eye, that's probably the most uncomfortable portion of the treatment. Okay,
I can handle uncomfortable, right?
Sure.
Anybody can handle that. But let's talk about the success. What happens generally after you have this procedure? Do you wake up and now you can see far away instantly, or how does that work?
That's a great question. So about 8 years ago, I had my own procedure. I ended up doing the LASIK, and before, anything that fell on the floor was like a search and destroy mission. I couldn't find it. I was crawling around. I decided to have the LASIK, and after I got up out of the surgical bed, the attending looked at me and he said, "Go ahead and tell me what time it is." So I looked across the room, which I couldn't see before, the clock, and I could read the clock dials. And that was day one. It was kind of a wow factor, and it was amazing to be completely honest.
Oh my gosh, had you worn glasses all your life?
I started wearing glasses probably around 3rd grade.
Really? How liberating was that for you? What did that feel like? Because a lot of people are sitting at home going, I'm on the fence, but you've told me some good things, and now I don't have to wear glasses ever again like that?
Right, the freedom has been life-changing. My only regret is I wish I would have done it sooner.
Interesting. Wow. And you're the one, you deal with the patients post and or pre and post op, is that right?
Correct.
So we're going to see you before and after, literally.
Right. Before and after. Hopefully more after than before.
Right. Hopefully much better after.
That's right.
No doubt about it. Dr. Salima, thank you so much.
My pleasure.
I really appreciate you being here and dispelling some of those myths. And guess what? Here's a little special offer for you. Nationwide Vision is offering LASIK starting as low as $299 per eye. Nationwide Vision has several locations for you to choose from. You can call 602-26-LASIK to find a vision center near you or learn more at nationwidevision.com.